question now, do you snore at night or have you been told you snore? That could be a sign of a condition known as sleep apnea. Approximately 5% of adults in the U.S. suffer from obstructive sleep apnea. And joining us live to talk more about this is Dr. Carl Moeller, an otolaryngologist specializing in sleep disorders at Hartford Hospital. We thank you for joining us tonight, Dr. Moeller.
Thank you for having me, Denise.
All right, well, our first question is, what is obstructive sleep apnea?
Sure. So basically what we're talking about is disruption of breathing during sleep. And this can range from simple snoring, which is vibration of the soft tissue during sleep, all the way to full-blown obstructive sleep apnea, which is actual frequent pauses in breathing during sleep, which can lead to drop in oxygen levels.
Well, the question is, does everybody snore a little bit? How do you know when your snoring is something that should be checked out by a doctor?
That's a great question. If there's any concern about sleep apnea or significant snoring, really the only way to differentiate between snoring and sleep apnea is through a sleep study. So if your bed partner has noted severe snoring or maybe pauses during your sleep, or you're waking up feeling very groggy and are really dragging throughout the day, that's really something you should mention to your doctor.
All right, that's good advice there. So what do we do about it, Dr. Moeller? If you have obstructive sleep apnea, how can we make it go away?
Sure. So if you're diagnosed with sleep apnea, typically the first line treatment is what we call CPAP, or continuous positive airway pressure. CPAP is essentially a mask that blows air into your mouth and nose and stents open the airway as we sleep. There are a large number of people that don't do real well with CPAP, however, and then we have to look at alternatives, which would include weight loss, an oral appliance your dentist could make, or surgical options.
Now, I understand that Hartford Hospital is going to be hosting a free class on all things related to obstructive sleep apnea. What can the participants expect to learn there?
So we're really going to delve into the symptoms of sleep apnea, how we diagnose sleep apnea, and then most importantly, we'll have an in-depth discussion about how we treat sleep apnea, including CPAP, and then we'll really delve into surgical options, including newer options such as robotic tongue surgery, which is something we're offering at Hartford Hospital now.
All right,
we hope everyone can come on down and see us.
I hope so too. I just have to squeeze in one last quick question, if you could. Why is it so important that this is treated? Because it can cause some big problems down the road, correct?
Absolutely. So we think about short-term side effects or short-term ill effects of sleep apnea, and the main thing there is severe excessive daytime sleepiness. That can increase the risk of traffic accidents, can lead to poor performance in school for kids or hyperactivity in kids, and can lead to poor work performance and overall cognitive problems. Over the long term, there are major ill health effects, which include an increased risk of high blood pressure, diabetes, stroke, heart attack, and irregular heartbeat. So it really is something that needs to be diagnosed and treated.
All right, when in doubt, get it checked out. That's what we always say here. We thank you so much, Dr. Moeller, for joining us tonight. And Dr. Moeller will be on hand for that free class on September 9th from 6:30 to 8 p.m. That's in Wethersfield. And for more information on the class, or if you have a question for Dr. Moeller, he's available live on our web chat right now. All you have to do is go to WFSB.com.